where do I start? The health service is in a perpetual state of crisis. You know this, I know this, we all know this. We see it every day in our advice clinics. We read it every day in the newspapers. And this started a long time before you've had the really convenient excuse of Brexit, which I get you're blaming for everything that goes wrong. But in truth, we've had 8 years of Fine Gael in government, 4 budgets with your very best friends there in Fianna Fáil. And what has it brought us to? We know that people can't afford to go and see a GP. They go without. They wait until they're really sick, till they have multiple ailments, and then, if they have it, they spend the €60 to go and see a GP. In primary care, you increase the threshold for medical cards for the over 70s. That will indeed benefit many people. As a move towards universal primary care, I obviously do welcome that. But what about the people who are under 70? What about the young worker living alone who earns a little over €184 after tax? There will be no medical card for them. What about the couple with a child who earn over €266.50 after tax? No medical card for them either. Sinn Féin proposed that the rollout of universal free GP care could have been advanced next year by giving everyone without a medical card or a GP visit card 2 GP visits without charge per year in order to lift the burden off workers, families and young people. That is the burden of being sick, which many of them cannot afford. The measure we proposed would have benefited 2.8 million people. It would have benefited the retail worker, the mechanic, the butcher, the prison officer, the student, the teacher, the tradesperson and many more. You announced nothing for them to make their lives easier or to give them a break. Home support waiting lists, those people who need just a few hours' help in order to stay in their own home, stands at 7,000 people. Almost 1,000 of them are in North Dublin. I know this because many of them come to me looking for help. They're not looking for much. All they're looking for is a couple of extra hours. That's all they need to help them stay safely in their own home. The service has been particularly targeted through cuts and the freezing of hours over the past 6 months. We have heard countless stories of children who have had to cut their work hours or give up their jobs in order to be able to provide care for parents at home. The same goes for parents and children with disabilities. They've had to take up full-time caring duties because of the lack of home support. You could have tackled this in the budget if it was a fair one. You could have taken part of the burden of care off of those caring for loved ones, but you didn't. The Government heralded the allocation of 1 million extra home help hours as a key measure of this budget. However, this addition will barely clear 40% of the home support waiting lists. Minister Daly confirmed as much to me today at the health press conference. Your 1 million hours will still leave people on waiting lists with around 1.5 million hours of home help still needed. And what are these people supposed to do? A targeted allocation of €59 million was what was needed to control and to get rid of these waiting lists. That's what the Department of Health and the HSE told us, and that's why Sinn Féin included it in our alternative budget. This budget, like others, was about choice. You had the option to choose to do the right thing, to invest in areas and people that need it, but you didn't. There are nearly 700,000 people on hospital waiting lists throughout this state. And what's your response? An additional €25 million for the National Treatment Purchase Fund, a scheme which those working in the health service say does not represent value for money. In fact, they go so far as to say it is a cynical exercise in waiting list manipulation that does not ultimately improve care for people in the medium or the long term. You chose to allocate scarce resources into the private health sector at the expense of increasing resources for the public hospitals. And I honestly tire of saying this, because when Fianna Fáil were in government and the geniuses there in the health department working with them came up with the idea of the NTPF, it was as wrong then as it is today. It didn't work then and it isn't working now. And every year you put more money into the National Treatment Purchase Fund and we see the outworking of that on waiting lists. Waiting lists are not going down. It doesn't reduce the numbers, it just takes money off of the public health service. Outpatient waiting lists grew last year by 54,000 to 569,498, while the number of patients waiting over 18 months has grown by 24,000 to 106,786. Minister, the National Maternity Strategy needs at least €7.5 million per year over the next 10 years just to keep it on track. And I won't be distracted by a task force What we need is implementation. There's a strategy there. You simply need to get behind it. What we see in the budget, €8 million to be allocated between 4 essential and key health strategies: the cancer strategy, the maternity strategy, the trauma strategy and Vision 2020, the ambulance reform plan. No measures in the budget to reopen closed beds in order to address the crisis in capacity, and no idea how those 4 strategies are expected to deliver on the budget that has been allocated to them. Neither have we seen a breakdown of what money is going to which strategy. It is no wonder that the Irish Hospital Consultants Association have voted no confidence in the Minister for Health. Indeed, the Irish Medical Organisation have said that this budget will not allow for any new service development, while existing services will be further stretched. You could have given a medical card to every patient who has cancer for the duration of their treatment, or for however long they have cancer. That would have cost €40 million, or 0.0002% of the overall health budget. You could have invested in problem gambling supports to help with the epidemic of gambling problems that people are experiencing right across the state. You could have invested in helping women by rapid funding the National Maternity Strategy, by tackling period poverty with actual money and resources, and rolling out a state-sponsored contraception scheme to provide for free contraception for all women. You could have invested in hiring additional staff that are needed to reopen the 500 beds that were closed by Fianna Fáil. Minister, there is nothing in this budget for children in my constituency who wait 33 months for the thing that you guys called early intervention. In fact, if you had any shame at all, you change the name of that. You cannot call it early intervention if a child waits 33 months. This budget, like all budgets, is about choices. It's about priorities and it's about ideology. You have nailed your colours very firmly to the mast. You've delivered a budget for landlords, for private healthcare providers, for speculators and for bankers. Sinn Féin would have made different choices, which would have helped workers, families and young people, the people that we always stand beside, the people that we are proud to stand up for.